Shatawale on God. Be the hour of the day. How for do? Yes, so like I said, we are pleased to, we're privileged, in fact, honored to have Dr. Henrietta Norkai Ocran. She's a family physician and specialist at the UGMC. We're talking high blood pressure. So today we'll be just taking it easy, just so that people get the information they need so that they live better. This is your lifestyle, leisure, and business radio, LLB. If it is impacting your lifestyle, if it's going to affect your leisure, which then leads to your income generation capacity and capabilities, ZFM is interested in it. We are your LLB radio, lifestyle, leisure, and business only, no politics. Good morning, Doc.
Good morning, Jerry.
It's great to have you.
It's a pleasure being here.
How has been the day so far?
Oh, by the grace of God, it's been good.
You've not gone to the hospital, Sylvia?
Not yet.
Okay.
You're ready for action.
After I know.
After this place, yes.
So this conversation started up sometime last week. We were talking about non-communicable diseases, and the fact that more often than not, our attention is on the communicable ones, the ones that you can catch, and so there is always the hype around them. However, the figures are showing that the NCDs are also really rising, or they might even have overtaken communicable disease. So subsequently, we want to be touching on these things. So today we just want to talk about hypertension. What is hypertension? Because it comes with the number of names, local balance and all that. BP. What is it? Tell us about it.
So basically, hypertension is elevated blood pressure. So there are figures involved, but then when you have increased pressure in your blood vessels, in your arteries, that's what we refer to as high blood pressure or hypertension. Yes. Usually the normal would be 120 to 80. Being 120 would be the systolic blood pressure, and 80 would be the diastolic blood pressure. And then there's a range, actually. But beyond 130 to 139, we would say elevated blood pressure, but we will not categorize you as hypertensive yet. Now, beyond 140, 90, then we will start categorizing you as hypertension stage 1, and then stage 2, and then onwards. But basically, somebody will come and say, my BP has gone up.
Yeah, yes. That's a common one.
Yes, that is hypertension for you.
And what causes hypertension?
So there are a number of causes and risk factors. So we divide them into primary and secondary. So for primary hypertension, there's no secondary cause, as in there's nothing precedes it. So for instance, somebody who has a genetic predisposition, so the family history of hypertension, they are more likely to get hypertension, especially if they don't watch their lifestyle as they are growing. Because then you have the risk factors setting in, and it's easier for them to get hypertension. And then you have the secondary hypertension. That's due to secondary causes like kidney disease, diabetes, hormonal problems like thyroid goiter problems, hyperthyroidism. You can have from heart problems, coarctation of the aorta, fancy names, but yes, heart diseases,
coagulation of the aorta. Yes,
fancy names, and then also drugs, alcohol, smoking. Yes, they all fall under risk factors, but they also cause hypertension. Cocaine would also do that. Amphetamines, methamphetamines, would also do that.
So in effect, Doc, it means you could have a drinking buddy that you go out to drink with a person every day. But if genetically the person is not so predisposed to this, the two of you will drink and you might die and he will still be around.
Yes.
Because yours had some genetics that didn't go well with you.
Yes.
And you didn't know.
So you have to be extra cautious.
Okay. So how is hypertension diagnosed in the first place?
Okay. So first of all, let's say a patient comes to the clinic. You have to take a good history. Some people come with symptoms, but largely hypertension we call it a silent killer. 30% of patients will not even realize they have hypertension. And that's where the problem is, because their blood pressure, when it goes up, they don't have any symptoms to alert them. So you and I, once there's nothing wrong with us, we go about our business, our daily business, without going to check anything. We are fine. We go partying, left, right, center, and all that. But for some people, they will have symptoms. And they are the fortunate ones, because then they have symptoms like headaches, they have palpitations, they have chest pain, they have shortness of breath, dizziness, they easily feel tired. So that alerts them that, okay, I need to check myself, go to the hospital. The easiest place is some people just go to the pharmacy, and then they check their blood pressure, realize that it's gone up. So then they come to the hospital, and then we take our history, and then through the history also try and find out what precipitated it, if there is a cause, or if there's a family history of it. And so that's for the history part. And then on our examination, you have to check the blood pressure. Now, blood pressure is easily checked by using the sphygmomanometer, the blood pressure reading machine. And now it's all over the place. In pharmacies, at homes, you can get it. And then in the hospitals. And usually what we do is we let a person sit down for about 5 minutes, relax a bit, and then we check. We wrap the cuff around their arm, and the cuff size is also quite important, because if you use a small cuff, that will not give you a good reading. So an appropriate cuff size, the bigger it is, the better. And the bigger it is, the better. Usually we take 2 readings, and depending on the level, then we take action.
Oh, okay. Yes. So the different stages, you said there's stage 1, there's stage 2. For each stage, what are the recommended treatments? How do you handle it before? Because I'm thinking the stages means that we are graduating to more dangerous levels.
Yes.
Stage 1, stage 2. Yeah.
Yes,
so if someone can come and you already know they've gone beyond a certain stage and all that. But let's start from, how do we go up?
Yes. So first and foremost, lifestyle modification. Lifestyle modification is an important part of the treatment for hypertension, because that could bring down your blood pressure levels even without medication. That's depending on the stage. So for the initial stage, the first stage, yes, between 130, 139, changing your lifestyle. So that's where you need to find out the patient's risk factors, or the person's risk factors. Now, if the person takes in a lot of salt, the person has to reduce it. They say 2 grams of sodium or 6 grams of salt. That would be about a teaspoon of salt in the person's diet, no more than that. That goes hand in hand with increasing your potassium intake. Potassium is in avocados, grapes, tomatoes. Reducing your alcohol intake. So your drinking buddies, you have to advise them.
Guys, doc said reduce your alcohol intake.
Reduce your alcohol intake.
Those that are always scaring me that I didn't buy beer for them, I have stopped. I'm not buying beer for you. You know who I'm talking to. Yes. Yes. I'm helping you live a healthy life.
Yes. And then a sedentary lifestyle also doesn't help. So sedentary means you are not walking. Lots of our jobs these days involve sitting a lot. And so if you are going to sit in the office the whole day, then when you get home or before you get to work, you have to exercise. And the exercise recommendation would be at least 30 minutes a day for 5 days a week. That's for moderate intensity exercise. For high intensity, about 20 to 30 minutes a day for 5 days a week. And that exercises can be brisk walking, swimming, anything that you enjoy, tennis, but it has to be intentional. It's not that, okay, I went to watch it from the roadside and back, and I walked with my friends, so I've exercised. No, it has to be intentional. It's a prescription. And the more you do, the better, because every exercise that you do reduces your blood pressure within a certain range. Sleep is also very important, because stress causes, it's a risk factor for hypertension. So these days, there's lots of stress in the system. So we're getting young people also getting hypertension because people are really stressed generally. And some people have gone to the extent of even changing their jobs because the job is too stressful. It's impacting on their hypertension, on their blood pressure. And so they need to do that to bring their blood pressure down. And that significantly helps.
Wow. Yeah. Sleep.
Yes.
Just sleep alone. I mean,
so we recommend that you have at least 6 hours of sleep.
From where? I mean,
at least in the night. Yes.
So if I slept at night, yeah, but I mean,
that's why I said at least, because some people are not able to sleep. Some people have sleep difficulties.
That's what I was going to ask. Because I can't do 6 hours straight. I'll wake up. I just can't do it.
That's how your metabolism is. But you have to try and relax. So apart from that, relaxation exercises are also there. Yoga is there. Meditation exercises are there. Anything to try and relax you would help to bring your blood pressure down.
Doc, you think as a people we're too stressed? Is it modernity? I thought all the technical advancement, the technological advancement, if I can say that, we're supposed to make our life easier so that we'll relax more. Why are we still too stressed? When they come to the hospital, you don't ask them where the stress is coming from.
We always ask them. And it could be financial, it could be marital. I mean, some people do have serious marital issues that impact on them. It could be family, it could be kids, it could be anything. Yes, it's not just one thing. It could be multifactorial. So we try and delve into that. And if the person needs a psychologist to speak to, we refer the person to a psychologist. Yeah.
How does hypertension impact overall health?
So it comes with a lot of complications. Yes. Initially, I mentioned about the signs and symptoms and things like that. And then it comes with complications. So from the head, once the blood pressure is above a certain level, 160, 100, you are at risk of getting a stroke. Strokes come in two forms. Your blood vessel can burst, and then the blood will seep into your brain, basically speaking. And that is a stroke. And that will come with paralysis. You're not able to walk. You may not be able to talk, depending on how severe it is. Or it can lead to the blood vessel blocking, where because of the high blood pressure, it damages the inner lining of the arteries, and then it tends to cause blockage, which is an infarct. So that's one complication. Then from the brain, you can come to even the eyes. It can cause blurred vision if it goes on for a long time because it causes damage in the blood vessels in the eyes. In your heart, too, it can give you heart attacks. It can cause heart attacks. You can get heart failure where fluid accumulates in your lungs. The kidneys are also an organ that gets damaged with hypertension that's not controlled. So it causes... It impacts on the kidneys, and they can give you kidney disease, kidney failure, and all that. So it's just from head to toe, it can affect the whole body.
That's and so if left unmanaged, what are the consequences?
So your blood pressure will keep going up, and with time, you will have these complications setting in one way or the other. Like you said, it's a silent killer. So somebody can be there and just boom. Because they didn't even know that their blood pressure had gone up. And then they could be on the treadmill exercising, and then they collapse. They are brought in, their blood pressure has gone up to above 241 something. They didn't even know. And then we end up losing your life.
If a guy is exercising, how can his blood pressure kill him?
That is why you need to monitor. Because he didn't even know that his blood pressure was going up. So some people exercise, yes, but at the same time, they're drinking alcohol. We also mentioned about the genetic predisposition. So they probably didn't even know that they had the hypertension, but it's from the family. So they are doing what they need to do, but still they end up getting hypertension. Yeah.
So we the lifestyle changes that you're recommending to manage the hypertension, which is diet, exercise, and the stress reduction. If someone listening to us right now is to start, where would you advise a person start from? Or you say do all at the same time? Because I don't know when I would exercise, because by the time I get to the studio, it's already done.
Yes.
When do I get to?
So I believe you have a few off days.
Weekends.
On weekends, yes. So you can take the opportunity over the weekend to do a sport of some sort. You can golf, you can play tennis, you can go swimming, you can. Now these days, a lot of people climb the Ebi Mountain on weekends.
Yeah, the breathing is looking like more of a show off than real exercise.
Well, but it's a good way to exercise, because by the time they go up and come down, they've exercised their hearts, they've done some cardio, aerobics, and all that. So yes, it's fun, but it's a good way to do it, because some people, like you said, you are stressed during the week. So whatever you're going to do shouldn't also be stressful. It should be enjoyable, right? Your diet, reducing your fats. It's also important. I talked about sodium, but also reducing your diet. So there's an eating plan or a dietary plan called, it's supposed to help stop hypertension. It's called a DASH diet, dietary approach to systolic hypertension, or managing systolic hypertension, or stopping hypertension. Yes. So that involves cutting down on the bad cholesterol, on the bad fats, the saturated fats and the trans fats, which are in margarine, in butter, in baked foods. So those ones, what they do is they increase the bad cholesterol and then reduce the good one, the good cholesterol.
Okay.
Yes. So then we encourage people to have more fish, less red meat. Yes, chicken should not be fried, if anything grilled. Yes, seafood is also better. Fruits and vegetables are very important. So basically around those lines, not drinking or reducing alcohol intake.
Here we go again.
I've said it again.
Yeah, no beer,
it's
beer
very,
for my
very
friend.
important.
Yes.
And then smoking cessation is also important. I also mentioned about reducing your stress levels.
Yeah, I mean, so let's start from what should someone who has hypertension, what should their eating plan look like? Aside what we've said, that the foods they should eat, what should their eating plan look like? Because if you're in my shoes, you can't eat at 3:30 when you wake up. The show starts at 5:55. How can you eat? What are you going to eat at 5:55 and all that? What would you say the average person who has hypertension? How should you eat? If you're like me, that will eat after 2 and all that. What would you advise, Doc?
Okay, so I mean, so this is just a little, but we will go into the diet maybe another time.
Yeah.
Yes, but then let's say in the mornings, instead of drinking at your age, I don't know your age, but
yeah, Mr. Kokuyanksi is listening. The advice is for him.
So
yes.
Instead of drinking maybe heavy or concentrated chocolate drink with a lot of milk, with a lot of sugar in it.
Okay.
Because we said we'll have to reduce our cholesterol levels.
Exactly.
We'll go more for like a plant milk thing.
Okay.
Or you can have oats, which is also good in reducing your cholesterol level. The raw cocoa drinks, yes, they are also known to reduce blood pressure levels. So something light in the morning, tea, maybe without sugar if possible, because we also don't want you to get diabetes, because that also impacts on hypertension.
It's true.
Brown bread as opposed to white bread. Ghanaians like eating heavy breakfast, so like watching in the morning and then go
now
bed.
You're coming to DJ Wade's line. Yeah.
And go bed also. I'm not saying don't eat it, but it's not advisable to have it in the mornings.
It's not?
It is not, because they contain all the things that will let you put on weight, and obesity and overweight
leads to hypertension as well.
In the afternoon, you can have salad. In the afternoons, you can have a bit of salad, grilled chicken. And then if you're exercising, well, you then have the leeway to eat a bit more freely, not too strict, but at the same time, watching your sodium intake, yes. So if you take a plate, for instance, you can divide the plate into 4. Your carbohydrate should be a quarter of it. Most of it should be vegetables and then protein. And the protein should not be fried, advisably. And then we also advise people to not eat after 6, 7. Because then...
Doc, you are talking to Ben. Ben, our head of technical. He closes at 11 midnight. How can he not eat? He'll get getting during the midnight.
Yeah, so what happens then is you can have a tea or a fruit, the green apple, a fruit salad, something light after the 7, if you have to take something at 9, let's say.
Doc, does this not look like a rich man's kind of living, where you are deciding to eat grapes and apples? What about those of us on the streets that we can't afford to even enter a place and get grapes and all that? What do we do when we are at risk of getting hypertension?
Oh, so our local foods are even better. Now, if you take afternoon lunch, for instance, and I say have abum, kontomire abum, that doesn't have any oil. You reduce the salt in it. You have it with some kobe and then some apim, green plantain. You are good to go.
Not too expensive.
It's
not a rich man's one.
Garden eggs, abum. Yes. I mean, our local foods are even better. It's more the Western foods that are actually affecting us. So the problem is you come to work, there's no food, you didn't bring food to work. So then you end up going to buy fried rice and chicken. And with that one, the oils that are used in it are also not the best. They will increase your bad cholesterol. And then you have a lot of salt in it, Maggi and things. Wow. So then you are not helping yourself. So we advise, especially people who go to work the whole day, it's better for them to pack their food, because some of the complaints are that they have to have food from the cafeteria and they don't control what is in the food. So then we advise that they pack lunch.
Hey, Doc. Let's talk medication. Some have said that the problem with even this whole hypertension thing is you're giving some white folks medicine, and before you realize, you become dependent on it. And that also then develops into some other side of your body having issues. What is your take on this very thing? That using medication to stop hypertension as opposed to going natural, eating, resting, and all that? Yes.
So beyond a certain level of hypertension or blood pressure, 140/90 going, so you get 140/100 and above, you will need to taking medication to bring your blood pressure down. Yes, they have side effects, but most drugs do have side effects. That's what I usually tell my patients. So why don't you ask me, when you come to the hospital and I give you paracetamol, why don't you ask me that, doctor, what will the paracetamol do to me? What are the side effects of paracetamol? And then you decide not to take the paracetamol. But then when it comes to antihypertensives, there's always this inertia. People don't want to take antihypertensives. Yeah. One of the myths is that once I start taking antihypertensives,
it's for the rest of my life.
For the rest of my life. But usually what we tell them is that you monitor your blood pressure for us. We usually give you a form to monitor your BP morning and evening on it. These days there are apps that you can record the blood pressures on. Once we put you on medication, you monitor it, and then when you come, depending on your blood pressure levels, then we will know whether we should reduce the dosage or with time take you off it. But that will also depend largely on your compliance in taking the medication and your lifestyle change. Now, for some people, once they start changing their lives, of course, they were not doing that in the past. With the medication, their blood pressure is going too low. Not that it's normal. When it's normal, it means the drug is working. That's keeping your blood pressure down. But when you come and you're getting hypotension, for instance, your blood pressure is less than 100, the systolic, and the diastolic is less than 60, then we know that, okay, the medication dose is too high, we halve it. With time, you realize that you have to keep reducing it, and then we take the person off. But with that, the person keeps monitoring, doesn't stop monitoring, because they had hypertension in the past. Yeah. So those are the instances when we do take people off medication. But once it's keeping the blood pressure normal, we don't stop. Some people are also afraid of, especially the men, they're afraid of erectile dysfunction. And now it pops up on the reels, Instagram reel, Facebook reel. They are talking about all the side effects. And so it makes people afraid to start taking the medication. And therefore, we are having a lot of problems and challenges managing hypertension. But every drug does have side effects, and not everybody will experience those side effects. That's the thing. And so when we start you on medication, we give you a review date that is close, so maybe in a week, so that you come back and let us know, first of all, how your BP readings are going, and if you're having any side effects. Common side effects would be headaches, for some of the drugs, coughing at night for some of the drugs. So once we realize that, then we change to another class. There are several classes that we can change it to. So usually when people start and they start having side effects, they stop and then they don't come to hospital. So we advise that when you do have side effects, come. There are so many different types that we can try you on and then titrate against your blood pressure. And eventually you will get one that you are comfortable with, that you can take for years and years.
Yeah, but the erectile dysfunction, is it actually a known side effect of some BP drugs?
Some BP drugs do that, but you can't predict. Yes.
Oh, okay.
Some, and it's not that common. I cannot say it's that common.
But yeah, but it can happen.
It can happen, and then when that happens, we just change the drug to another class.
Okay, it's almost half past the hour 9, and we're in the final hour of today's show. It's Health and Wellness Tuesdays, as always, and we're having a great conversation with Dr. Henrietta Norkai Ocran. She's a family physician specialist at the UGMC, University of Ghana Medical Center. We're talking controlling high blood pressure today. Very, very important topic. And I think you're picking the takeaways from this discussion so far. Can hypertension be reversed or cured?
So, it's a chronic disease. So, once it sets in, it lives with you. But like I was saying, once you put in measures to the lifestyle prevention, put in accurate measures, you may end up being in the bracket of people who end up not being on their medication. For some people too, they get the hypertension because of secondary causes. Like let's say somebody who has a goiter and so their thyroid hormone is elevated. So in that case, once you solve the goiter problem, then
the hypertension automatically
will go away. So yes, it's a chronic disease, but it's all dependent on whether there are secondary causes that can be treated, or the person also changes their lifestyle significantly, because back in the day, let's say they were obese, they were fat, they were eating whatever, drinking whatever. They modify their lifestyle, and then you end up having to take them off the medication. But with that, we still monitor and follow up for the rest of their lives.
Interesting. So now let's look at the heart disease, kidney diseases, and diabetes that we spoke about, all these other conditions. And you said they all have a link with it. So which is the causative effect? The causative factor? Is it the heart disease that brings the hypertension, or the hypertension that causes heart diseases? What are the relationships between hypertension and all these diseases?
So it could be either way. So if you take somebody who has diabetes, now diabetes can end up damaging the lumen of the vessels and then end up leading to hypertension. So usually I will tell my patients that they're like sister and brother or cousin, they are family members. They follow each other. So you need to control one so you don't get the other. If you take kidney disease, for instance, hypertension uncontrolled can lead to kidney disease. Kidney disease also, if you had to get it from something else, let's say you go and drink some herbal medication and your kidney shuts down, or you get kidney failure for whatever reason, that could end up causing hypertension. So it's both ways. Yes. So you have to control both. The best is to avoid getting any of the above.
So in areas like my village where these things are not, is it possible to control in those low resource areas? Yes,
it is. So even if the area is low resource, we still have worst case scenario, worst case in quotes, you will still have a CHIPS compound, so a community-based health preventive service compound, where it's supposed to be at least adequately stocked with some antihypertensives. And then health promotion, health education also helps to educate the people in those areas on lifestyle prevention so that they don't get it. And then medication will also help. It's just about maybe stocking up and then making sure that whoever the healthcare professional is in that area is on top of it. So educating people to come and check their blood pressures if they don't have it in their homes because of, like you said, low resource setting. Then encouraging them to constantly come and be checking their blood pressure, because at least those facilities will have that in there. And then that's how we try and manage in those areas.
Are there gender implications to hypertension? Does your gender influence whether you get hypertension or not?
That is a bit of a tricky one. But when you look at the lifestyle...
Who is more at risk, Doc?
I would say males.
Okay.
More at risk.
Men who drink.
But men who drink.
Men who drink and smoke and don't exercise.
It's multifactorial,
okay.
Yes. Men who drink and don't exercise, yes. And then in females, you can even have pregnant women also getting hypertension. So there are lots of factors that influence your getting it.
How does pregnancy influence the person's getting or not getting hypertension? What will lead to pregnancy causing a woman to get into hypertension?
So, I mean, when it comes to pregnancy, it's a bit of a complicated situation. There's no particular cause, so you can't really predict that this person will end up getting it. But like I said, hereditary factors would at least prompt you to look in that direction. And then for them, we monitor them throughout their pregnancy, checking their urine protein, checking their blood pressure. So when it starts going up, immediately we try and grab it. But in terms of cause, it is quite complicated because you have the baby, the fetus, the placenta, and hormones being produced would end up triggering hypertension in pregnancy.
If no one in my family has ever complained of hypertension, how would I know if I have a family history or not? What should I do to know if I have, so that I start taking care of myself?
So that's why you have to constantly, as much as possible, check your blood pressure. Not just your blood pressure, your sugar levels. Doing annual medicals help, or every 6 months you come to the hospital, do your medicals, and when you show up, we do check your blood pressure. Now, there are pharmacies all over, so anytime you are going to buy something, you can just quickly check your blood pressure to see where your level is. And then there are also home BP machines that you can buy. Actually, you find that is also a very good way of diagnosing hypertension or catching people with hypertension. Some people come to the hospital, and then when they come, their blood pressure is up all the time. However, when they are home and they are monitoring it, it's down. And it's because once they get into the hospital setting, they get very, very anxious. They see sick people. No matter how much you try and calm them down, their blood pressure is still up. So home monitoring is very, very important, yes, in the follow-up of patients.
Okay. As a community, now let's go beyond the individual. What should families do? What role should families play in preventing this scourge of hypertension in our society? Families. I'm coming to the bigger communities. I want to start with families.
In terms of families, just basically being each other's keeper, because it's so easy to pick up. It is not something that you even need to come into the hospital to check. I keep stressing on the fact that BP machines are everywhere. So every home should ideally have one. So most people actually, we've gotten to the stage where most people do have a BP machine in the house. So somebody comes, their blood pressure is up. You ask them, do you have a BP monitor at home? Yes, we do. So as a family, from time to time, you can be checking your blood pressure. It's very easy to screen and to pick up. Yes, so just advising each
Ideally,
other.
Every family should have a BP kit at home. Something very basic that you can check.
Yes, because we said it's a silent killer. You may not realize that you do have it until it's too late.
Ben doesn't have. DJ Wade also doesn't have. Mr. Kwiku, I know you have. He has a lot of female medical practitioner friends. So, but we would advise that all staff of Z Multimedia should get one at home. And then also we'll try and help as a corporate body to see how they will get it.
And then for people who are not able to afford, people are always organizing health outreaches.
Okay.
All over the place. Churches, organizations. So people should just take the opportunity. It's free. You walk in, get your BP checked. There's always a health professional there who will advise you at the end of the day. And then once that's picked up, don't be afraid to go to the hospital for the doctor to assess and then to find out how you got it, and then preventing the complications.
Okay, so you can send your comments. Let them come through 0544 321019. That's the WhatsApp line as well. Send your comments. Doc is here to answer all your questions. I'm going to come to Doc and find out in those days where our forebears, were they getting BP, or our lifestyle, is modernity also a causative factor for high blood pressure?
Yes, it is. It is. So back in the day, we used to, the Western culture has greatly influenced us. So in terms of our foods, even what we eat, there are more restaurants now. Back in the day, well, you just had one or two Chinese restaurants, one papaya here. Where you go, you are very happy that you have actually gone out, one or two hotels. But now it's all over the place. So we used to do a lot more home cooking than before. Now we are actually having to eat out a bit more. Alcohol, drugs have become a problem. Marijuana. Now it's all over the place. There's a bit of a drug menace, which we'll go into another time. Yeah? Yes, that true. All those things impact on our currently getting hypertension. Our sedentary lifestyle, our work, corporate work, you end up sitting for long hours, and now we have elevators. Back in the day, once you get into a tall building, you will climb the stairs. So now we have elevators. So people don't exercise as much, they don't walk as much, their activity level is very low, and then they get home and they are so tired, they hit the bed, and then that's it. And then the next day, boom, it continues. So you have to make a conscious effort now to change your lifestyle, exercise, and yes.
Still on the discussion of the causes, are we becoming too materialistic as a people, and that is leading to increased stress, which is leading to hypertension? What is your take on that thing? Because when we have the discussions, we go genetic, we go dietary and all that. But are we chasing after too much? What would you say?
I can't say we are chasing after too much. I mean, this basic living, you can't help but work. I don't want to get into areas that will get me into trouble. But yes, just basically trying to eat and survive would mean that you have to work. Taking your children to school, it's not free. Well, yes, there's an area that I don't want to get into, but you will still have to pick transport to get to school, let's just say. And so you don't have a choice but to do certain things, and then that would lead to stress.
0303-956641. 0303-956641. The lines are open now. You can call and join the beautiful conversation going on about controlling high blood pressure, hypertension, right here on Z Health and Wellness Tuesdays. Dr. Henrietta Norkai Ocran is a family physician specialist from the UGMC, and she's helping us to actually set our lives on the right path so that we don't get into trouble. Ghana Health Service as a body, what is the authority doing in this angle to ensure that hypertension is controlled in this country?
Well, so there are a lot of health promotion, health education exercises that go on. We celebrate World Hypertension Day. There's a lot of, like I said, just throughout everywhere. There's education everywhere, and monitoring people's blood pressures all over the place. So, and they're making drugs available for people in the deprived areas and all that. So in terms of that, I think they're doing a good job.
Someone has said that we should ask that in mentioning, you said hypotension was also a problem. If hypertension is a problem, which is the up, hypo, which is the low, is also a problem?
No, so I was saying that you may end up taking a dosage of the drug that would reduce your blood pressure too low. Hypertension is also a different topic altogether. But if you're taking a dosage that is not suitable for you, because we do titrate the medications to your blood pressure, you will end up in monitoring, realizing that your blood pressure has gone lower than it should. And so when that happens, we reduce the dosage. But what that does is sometimes, for some people, it causes dizziness.
Okay.
Yes. So that will tell you that, okay, no.
It's too low.
It's yes, or the medication is too high. Let me go to my healthcare provider and let them reduce the dosage for me, or eventually take you off the medication.
Okay. World Hypertension Day each year is celebrated on the 17th of May. It's supposed to be a UN kind of a day where they use the opportunity to talk about hypertension and other cardiovascular diseases. Now, hypertension, cardiovascular diseases, what is the relationship here?
So hypertension is one of the diseases that leads to cardiovascular disease. So cardiovascular diseases could be your stroke, your heart attacks, your heart failure, all the complications that I did list. Yes, but you have hypertension, diabetes, obesity, increased cholesterol. All those things lead to cardiovascular disease. They increase your risk of getting those diseases, the cardiovascular diseases that I was talking about.
So hypertension is a causative effect, but not a disease in itself.
It is a disease in itself.
But it also causes...
Yes.
Okay. The explanation is now clearer. So yes, listeners, viewers, we're streaming live on Facebook. You can also join us. Please bring us your comments. 0544321019, and the line is still open. 0303956641. On Instagram, on Facebook, and on X, our handle is at ZFMGH. On TikTok and YouTube is at Z Multimedia, and the website is zmultimedia.com. So please, as much as possible, you can. We have a caller on the line. Good morning. Who am I speaking with? Nana, sorry, the line has a serious static. We'll try and sort it out and then get back to you. So Nana Sari was calling, but the line had a serious static in it, which she was trying to get through. Please call 0303 956641 or 0544 321019. 0544 321019. Dr. Norkai is here to answer your questions concerning hypertension and how we can handle it. I'm going to come to Doc. Doc, age. Are you noticing a trend? Or does age, we've spoken about gender. What about age and its influence on diabetes or the implications of that? So
the older age influences your getting hypertension, increases the risk of getting hypertension. So what happens is...
Okay, Doc, I'll come to you, but we have a caller on the line. Good morning, caller.
Good morning.
Please, your name and where you're calling from.
I'm Nicholas, and I'm calling from Syntes.
Okay, Nicholas, your question for Dr. Ocran.
Okay. I was asking if sleeping for more than 8 hours can lead to hypertension.
If sleeping for more than 8 hours can lead to hypertension?
Yes.
Doc would answer that. Thank you very much, Nicholas, for calling from Sphincters.
Sleeping for more than 8 hours, I cannot say will lead to hypertension. However, like I mentioned, there are lots of factors that would lead you to getting hypertension. So if you're somebody also who has a sedentary lifestyle, we would advise you to become more active and then exercise. But sleeping for more than 8 hours doesn't have a direct cause of causing hypertension. No,
okay.
It doesn't.
But it's even good because you are saying 6 hours.
Yes, because we want to reduce our stress levels, so that would help.
Okay. Thank you, Nicholas, for calling from Sphincters. The lines are still open. 80544 321019. You can call us right now, and you can also visit our handles, social media at ZFMGH on Instagram, Facebook, and on X at ZFMGH, and on YouTube and TikTok. It's Z Multimedia. ZMultimedia.com, that's the website. Please bring your calls, your comment as much as possible. We want to have a conversation around it. I have another call on the line. The static is still back. Please try getting through 0544321019. We want to listen to your conversations around hypertension. Are the younger people, in your experience at the UGMC or wherever you've worked, are you seeing more of the younger folks now coming in hypertensive
Actually, yes. So in the past, we used to get it more, or used to see more of the elderly people, because what happens is as you grow, your blood vessel, the lumen of your vessel becomes.
Good morning, caller.
Good morning, Jerry. How are you?
I'm good. Who am I talking to?
Kezia.
Kezia, welcome back again. Kezia, you will get an award one of these days. You are most consistent listener. Kezia, what's your question for Dr. Ocran?
Can children also get our children, the signs that we need to see if they are getting hypertension or something, or too much of oil eating will cause that?
You mean we're talking of children as young as how old?
15, 18 up to 20.
Okay. Thank you very much, Kezia, for calling. Dr. Ocran will answer.
Yes. So children can get hypertension.
Children can get hypertension.
Yes, and those ones is because of secondary causes. So for some people, they are born with heart problems, heart deformities, heart defects. So they end up getting hypertension. Some children can also get renal disease, kidney disease. So for them, when you check their blood pressure, it would be up. They come with certain complications that would lead you to then investigate for hypertension or look in that direction. But usually it's because there's a secondary cause. There's something that is triggering the hypertension. She mentioned about oils too. Now, the earlier you start modifying your children's lifestyle, getting them used to eating certain things, the better. I think as a country, or I don't know, Africa in general, diet is a lot more carbohydrate based, and that's what we are brought up with, I think. And that's, so we get used to, okay, our food should be plenty rice, plenty white rice, big fufu, big banku, small fish, and so on. But later on in life, when the person now has to change their eating pattern, their eating habits, then it becomes a problem. They'll say, doctor, I can't stop eating white rice. I'd rather take medication. Don't change it. Hey, so you're trying to tell me that I cannot eat this food or that. And it's because from childhood, they weren't trained that way. So the earlier we start educating or trying to get our children into the habits of eating fruits and vegetables, the better. And it doesn't have to be anything expensive. An apple here, bananas there, pawpaw here, mangoes there. So they get into the habit of enjoying eating fruits and vegetables.
Good morning, caller.
Mr. Jerry, this is Richard.
Yes, Richard.
Yeah, I want to know whether sudden fright can cause hypertension leading to stroke.
That's a fantastic question, yeah.
Yeah, because it has happened in a lot of cases that I've seen. I'm not a doctor though, but the people did not have any previous history of hypertension. Maybe they were predisposed, but something just puts them in that fright mood, adrenaline rush or something, and then boom, they just.
Yes.
Please, your name and where you're calling from again?
I'm staying at your locality, Jansuman.
Interesting, and the name is.
My name is Richard.
Richard from Dansoman, thank you very much for that fantastic question.
I always listen to you, Jerry, so add me to your consistent listeners.
Yes, you and Kezia, Richard and Kezia,
right.
Fantastic.
Okay,
Doc,
thank you.
Sudden fright.
Yes. So he mentioned about adrenaline. Yes, so it's not just sudden fright, excitement, overexcitement. So these people may already have their predisposition or may already have hypertension and not be aware of it. And then something significant happens, and then the adrenaline kicks in, their hormones kick in, and then it causes what we call a sympathetic reaction, where your pulse goes up, your blood pressure goes up. Even watching football can even do that, when you get excited about
like Black Stars.
No,
Champions League, it depends on the team you are supporting.
Yes.
If you're a Real Madrid supporter, you are safe. Then support another team, you might you might be in trouble.
Yes.
But that's a good question. Sudden fright.
It's a very, very, very good question. So when that happens, it shoots the blood pressure up. And then beyond a certain level, if you already have a lot of damage that has occurred in the blood vessel and then in the brain and things like that, or in the heart, then the next one that triggers a high surge, an upsurge of your blood pressure, you may end up popping a vessel and then you bleed. So that's what happens. But for these people, it's because silent killer, like we said, they didn't even know that they had an underlying problem for them to be monitoring and doing something about it. But yes, sudden fright and overexcitement can do that.
Interesting. Doc,
or extremes of emotion.
Okay, extremes of emotion.
Let me put it
a
that
big
way.
shock.
Yes.
Something like that.
Yes.
Okay. Doc, your final advice for Ghanaians. If there's talk to us. As a doctor, talk to us.
Lifestyle modification is a very, very, very important thing to do to prevent hypertension, to prevent diabetes, the non-communicable diseases, obesity, and changing our lifestyle, reducing our salt intake, reducing our alcohol intake, exercise is very important. You need to make time for it and do something that you enjoy. Try to reduce your stress levels as much as possible in whichever ways that you can, and that would just help to reduce your chances of getting hypertension. And continuously monitor. There are blood pressure machines all over the place. Come to hospitals for your medical checkups, and that will just keep all sorts of diseases away, or they're picked up early and then something can be done about it.
Dr. Henrietta Norkai Ocran is a family physician specialist from the UGMC, the University of Ghana Medical Center, and that was Health and Wellness Tuesday. The topic was controlling high blood pressure, hypertension. It's been amazing having you, Doc. We should bring you back again for more of the conversations.
It's been a pleasure being here, Jerry. Thank you so much for having me.
We're pleased to have you.
At your service.
Thank you so much. So, listeners, all too soon, Z in the morning, wrapping up. But before we do, what else can I say? Pray like it only depends on God, but work like it only depends on you. We'll do this again tomorrow, people. Have a great one.
It's your lifestyle.